Hello and welcome. It is noon, so we're going to go ahead and get started as people are still filtering in. As we get started, I just want to remind everybody that there is a poll opportunity during today's lecture. Dr. Rodriguez is going to introduce that to us, and if you would go ahead and on the left-hand side of your screen, you will see some information, or also in the chat box, about how you can log into that poll. So if you want to go ahead and start doing that so that you are ready and already in, and when Dr. Rodriguez introduces the poll, that would be great. So welcome. I am Robin Axel Adams. I am the manager of the Fairbanks Center for Medical Ethics. We are so excited that you are joining us today for our remote lecture. Just a quick note that applications are open for the Fairbanks Fellowship in Clinical Ethics. You can see our website, fairbankscenter.org, and click on the Fairbanks Fellowship in Clinical Ethics to be able to see our application. And there's also a recording of an information meeting that we had last week. A few preliminaries about today. We know that there could be technical glitches, and we just thank you that you have patience work with us through any technical glitches that we might experience. You will receive a link for the evaluation for CME and CE tomorrow at the email address that you used when you registered for this webinar. You must complete that evaluation to receive credit. And when evaluations close on April 2nd, then you will be sent out your certificate. So it will not be sent out until after April 2nd. But we do encourage you to fill out the evaluation, even if you do not need the credit, because this helps us track attendance. And then you also can provide feedback and comments on the lecture. This webinar is being recorded and is going to be available on our website, fairbankscenter.org, within the next week. Those recordings are eligible for CE for 1 month and for CME for up to a year. So we encourage you to send this information to your colleagues for that, to be able to get to that. Our question and answer box is available to you to post questions, but we won't be responding to most of them until the end of the presentation when Dr. Rodriguez is ready. And Dr. Rodriguez has no financial conflicts of interest to disclose. So those are all the preliminaries. Let me get along to introducing Dr. Rodriguez, because I'm so excited about this lecture. We had a preview yesterday, and I just know that it's going to be so valuable to so many people. So Gabrielle Rodriguez, or Gabby, is a licensed psychologist and assistant professor of clinical psychology, psychiatry at Indiana University School of Medicine. She is the co-director of the ADHD and disruptive behavior disorders program at the Riley Hospital for Children, Child and Adolescent Psychiatry Clinic. Dr. Rodriguez earned her BS in psychology from the IU School of Bloomington, and she earned her PhD in clinical child and adolescent psychology from Florida International University, where she was a Worlds Ahead graduate. She completed her clinical fellowship internship at the Kennedy Krieger Institute and Johns Hopkins University School of Medicine, and her postdoctorate fellowship at Harvard University. Dr. Rodriguez's research interests include effectiveness and implementation of evidence-based interventions for youth mental health problems within community settings. Her clinical works involves assessment and treatments of ADHD, disruptive behavior disorders, and comorbid disorders using evidence-based treatments, including parent-child interaction therapy, or PCIT, and the modular approach to therapy for children with anxiety, depression, trauma, and conduct problems. Through this talk, she's going to be providing a lot of information, a lot of really great information. And at the end of her talk, she's going to provide a lot of links to some amazing resources. And for those of you who are watching live, we will send out those links tomorrow. So you don't have to hurry and try to take a picture of them or write them down. We will send out those links tomorrow. So with no further ado, I would like to turn this over to Dr. Rodriguez, and thank you so much for the information you're going to share with us this morning.
Thank you so much. I'm happy to be here. I appreciate everybody joining us today. I want to start out by just apologizing for any background noise. I do live right downtown, and so there may be some sirens in the background. I will try to mute myself if I can, if they're very, very loud. So today I'm going to be talking with everybody about the, let's see here, if I can get it to move forward, the impact of COVID-19 pandemic on child and adolescent mental health. I think this is a very important topic close to my heart, and I think lots of folks have been thinking about this a lot in the past several months. Before we get started, though, I want to really hear from you and kind of see what are some of the things that have been on your mind related to this topic, and then we'll get going. I'm going to stop sharing very briefly here so that I can go ahead and show you this poll that we've been talking about. Pull that up here. All right. I'm going to start sharing here again in one moment. There we go. All right, so please go ahead and go into this poll. I'm going to activate it and share it. And then go ahead and let us know in one word, what impact you think COVID-19 has had on child and adolescent mental health. I'd really love to hear what y'all are thinking. Withering, interesting. I love that. Isolation, lonely, overwhelmed, serious, anxiety, fear. Isolation is a big one here. Okay, stress, depression, overwhelmed, unseen, fear, lonely. Yeah, isolation seems to be a really big one here. And depression, anxiety, stress, fear, loneliness are all, things that it seems like folks have really been seeing be a concern for the kiddos in their lives. I'm going to go back to, again, sharing the PowerPoint here so that we can talk a little bit more about that. All right, so those are all things that we've definitely seen and that we'll be talking about today. So I appreciate y'all sharing your thoughts about those things that you've observed. Before we continue, I want to take a second to just say Happy National Social Work Month. I know it is a really, really tough year to be a mental health provider, and I just want to acknowledge that social workers are absolutely essential in the backbone of our mental health services, especially for kids. And so happy National Social Work Month to everybody. So let's talk about our objectives for today. We're going to really be focusing in primarily on first recognizing what are the effects that the pandemic has had on child and adolescent mental health. And we're going to talk about some different approaches that we can take to supporting kids and teens during this time. And then finally, we're going to identify some resources that are relevant to share. So let me know if this sounds familiar. Our folks, and you guys can use the thumbs up or any of the different, oh, okay, sorry. I just heard that the screen is showing us the presenter mode. Is this better? Hopefully it is. I think I just swapped it. So this is some of the things that we've been seeing online, right? So we've been seeing just news story after news story about the way that COVID is affecting child mental health. So we've got, partly hidden by isolation. Many of the kids' school children struggle with mental health. This is from Washington Post. NPR telling us the pandemic is taking a toll on child mental health. BBC News telling us the devastating toll of the pandemic on children. NPR telling us again, we're worsening, the child mental health crisis is worsening. And this one just from this week from CNN, why kids are hitting the pandemic wall. These are all, I think, really scary for us to see in the news kind of over and over again throughout the past year. And so I thought we could take a second and look at what's the science telling us? What are some of the kind of studies telling us about what's actually happening with child mental health? So this is actually a study that came out really, really early on in the pandemic. And actually, I think they used data from 1946 to the end of March of 2020. So really kind of a quick response here as soon as COVID started kind of affecting us here in the US. And what they actually looked at, given that it was so early on, was the effect of social isolation and loneliness on youth mental health. So they were able to look at 63 studies going back, like I said, all the way to 1946 with over 50,000 participants. And what they found was that loneliness was really associated with future mental health problems up to 9 years later. And this association was especially strong for depression and social anxiety. And one of these studies was actually pretty cool in that it looked at mental health problems specifically after an isolation or quarantine in a previous pandemic. And what they found was that kids were 5 times more likely to require mental health services and to have higher levels of post-traumatic stress if they had experienced an isolation or a quarantine as a result of a pandemic. By the way, I'm including all of the titles here so that folks can go back and look at these if they're interested, because I'm summarizing them very, very briefly. All right, and the other thing I've done is tried to kind of organize them by when they came out. So this last one came out, very early on in the pandemic, and then we'll kind of move through what the science has been telling us as time passes. So this study here published in Pediatrics was accepted in July of 2020, but the data was from February to April of 2020. So a couple of months, right in the beginning there of the pandemic. And this one published on the results of a daily survey of hourly service workers with a young child, so ages like 2 to 7 in a large US city. And what they found, not surprisingly, was that parents reported that their daily negative mood increased significantly since the start of the crisis. And what they also found was the higher the number of COVID-related hardships that the family experienced, the worse that the child and the parent's psychological well-being was. So these are things like job or income loss or caregiving burden or actual illness. This is an opinion article here that was published in April of 2020 in JAMA Pediatrics. And this one is interesting because it really talked about some of the concerns that these other articles have already shown us, right? We're worried that the pandemic is going to worsen existing mental health problems and lead to more cases because of that combination of the public health crisis, the social isolation, and the economic recession. You might ask yourself, well, how exactly does an economic recession associate with child mental health, right? Like, what's the kind of link there? And what they're suggesting here is that we know that economic downturns are related to these increased mental health problems in kids, likely because they affect adult unemployment, adult mental health, and also rates of child maltreatment. The other thing they suggested was that, as we've all learned, school closures are going to affect youth mental health for a whole host of different reasons, but also including that schools are a major source of mental health services for youth. And so they talked to us here a little bit about what are some of the things that could help, right? What were some of their suggestions back in April of 2020? And luckily, many of these have already happened. So I think that's really good news. I know I've been not sharing too much good news just yet, but one of the things that they suggested here was that we facilitate telehealth services. One by having Medicaid do full cost reimbursement for telehealth services. And then also what actually ended up happening was that the Department of Health and Human Services kind of put out a limited waiver to loosen the HIPAA rules so that we could use tools that were previously non-HIPAA compliant, like FaceTime, to provide services. And both of those things have happened and have really facilitated telehealth services for children and families. The other thing this article recommended last year was that schools coordinate with community mental health centers to deliver services in schools. And actually what ended up happening here in Indiana was that legislation was passed in July 2020 requiring schools to do this. So now Indiana school corporations have to enter into a memorandum of understanding with a community mental health center or another licensed provider to be able to provide those services. So all good news that all of these recommendations that were made really early on to try to mitigate this impact that we've been talking about did end up actually happening. This is a little bit later on. So this was in July 2020 that it came out with information available until May 2020. So a rapid review here, looking at youth anxiety, depression, and traumatic stress during COVID. This one was pretty interesting because it included 6 studies. They had a little bit more stringent criteria, and they included 6 studies, 4 from China and 2 from the US. And non-surprisingly, again, they found an increase in depression and anxiety symptoms in youth since the start of the pandemic, with prevalence estimates that were really kind of broad, ranging between like 18% and 43%, depending on how you were measuring the youth depression or anxiety. think it's important to take a pause here and just mention that, these studies didn't have any pre-COVID data. And so they're really just looking at what's happened since the start of the pandemic until now. They're not able to compare to what was going on before. It's also a really small number of studies, right? To have 6 studies, and it was not longitudinal. So kind of highlighting all of the work that remains to be done for us to really see what the impact is truly going to be for kids and families. All right, this next study here, a little bit later on again. So this one was in August of 2020, a narrative review. And now at this point, we had some more articles. So at this point, they're examining 22 articles looking at kind of the impact of the pandemic. And what they found was that for young kids, what they were really observing was more clinginess, kind of problems with sleep. So problems with staying asleep, falling asleep, having more nightmares, poor appetite for young kids, and also some inattentiveness and significant separation problems from their families. For school-age kids, what they found was that really the loneliness, anxiety, and uncertainty was most of what school-age kids were experiencing. And they found that the risk was higher for school-age kids who already had an existing mental health condition before the pandemic. Then for teens, what they found was a lot of increased anxiety about the cancellation of events. So things like exams, academic events, social events. And I think we all kind of remember, what it was like here in May of last year, seeing lots of kids who were really, just really, of course, upset about having to miss out on really important events during like senior year of high school, for example. This also is a really cool article because they have some detailed recommendations for parents, for school staff, for primary care providers, for mental health providers, and for policymakers. We didn't have time today to go through all of those, but I encourage you to check this one out if you kind of fall into one of those groups to see what are some of the more detailed recommendations that these folks provided. So we've been talking a lot about what's been going on, right? What are the challenges? What are the concerns? And I think it's important to also think about, well, what can we do? How do we support kids? And how do we support resilience in particular, right? So the idea of that positive adaptation in the face of adversity for kids and families. And what this article is, this is a commentary. So it's not doesn't have any data, but it's a commentary based on kind of previous research looking at these known protective factors. And the idea here is that we know that things like warm and responsive caregiving, caregiving that's characterized by lots of structure and monitoring, are all known to be protective factors for kids and teens in their mental health. Also social support and access to sufficient social services and healthcare. Of course, many of those things are challenging in COVID, right? I mean, we know that parents are incredibly stressed right now. And so warm, responsive caregiving is going to be harder to come by, and understandably so. The levels of structure and monitoring maybe are a little bit higher because a lot of people are home with their kids, but definitely social support has been more challenging. And so, I think really thinking creatively about how can we take what we know about these protective factors and try to modify our lives in such a way that we try to get closer to them. It's kind of an aspirational goal. So now that we've covered kind of what the science has told us so far about what's going on with the impact of COVID on child and adolescent mental health, I want to talk a little bit more about kind of some practical tips and things that we can really do as adults to support our kids and teens. So the first is, I like the word cloud that we saw in the beginning. It's really similar to, what I'm seeing in my clinic. And it's, kids are anxious, they're angry, they're frustrated, they're bored. There's, all of these reactions that we're seeing are really, really common for kids across all ages. And they're okay, right? It's okay to have these reactions. We just have to kind of figure out what we can do about managing them and how to be successful despite these reactions. So one thing that I am asked a lot is kind of what to look for, right? Like when do these reactions that are here start to become really problematic? Because everybody's having these, right? So when are we thinking it's going beyond our kind of typical reaction to a really unprecedented situation? So what I usually say is we want to look for problems that are recurring. This has to be something that's going on really regularly for us to really think, okay, this is concerning. We probably want to do something about this here. Of course, we're all going to feel afraid sometimes, nervous sometimes, bored, depressed sometimes. We're talking about things that are really continuing across time. We're also looking for things that cause significant distress, right? And usually this is distress that's getting in the way of our daily life. We're not able to do the things that we can do, right? Even within the age of COVID, even the things that we're able to do are not happening because of these kind of emotions or reactions that are occurring. I want to talk a little bit more about some of the youth that are at higher risk. So these are the kiddos that we want to pay special attention to during this time. As we mentioned earlier, right, we know that for kiddos with existing mental health concerns, we know that these types of situations are likely to exacerbate those concerns. It might look different though, depending on what the problem is, right? So anxiety, right? Kids who have some pre-existing anxiety, maybe some of them might feel a little bit better during these days. Maybe if, school or grades were a big source of stress in the past, they're not feeling as stressed about those things anymore because they're not really happening. But it might be worse for some kids with anxiety, especially kiddos who have fears about getting sick or leaving the home, right? Once we've been home for months and months and months, you can see how it would be much more challenging than if we were already afraid of leaving home in the past. Similarly with behavior problems, right? So for some kiddos, especially those who are doing some e-learning now due to COVID, things might be a little bit better if school was a really big source of stress and was the primary place where we were seeing these behavior concerns. Or it might be worse, right? So now we're home all day with a lot less structure than we're used to having at school, possibly with siblings all in the same space. So we can also see for kids with behavior problems that it's possible some have improved, possible some have gotten worse. Again, with depression, if for some kids I've observed that depression has improved a little bit, especially if it was really related to things like bullying at school or things like that. Now we're away from that really harmful environment. So naturally our mood is going to lift. But it might be worse, right? For lots of kids, we're not doing much during the day, right? So this might lead to some anhedonia, and we just don't really feel like doing anything other than kind of sitting around, and that can definitely lower our mood across time. Suicidality, I'm going to talk about a little bit more in detail later about kind of what to do when that's the concern. But I think along with these, worsening depression can come increased suicidality and having more thoughts about being better off dead or not wanting to be here or wanting to die by suicide. And so these are all really important areas that we need to be paying attention to for these kiddos. Another group that's at higher risk are families who are already involved with CPS. We know, as we mentioned earlier, that increased parent stress predicts physical abuse and neglecting kids. We also know that, and I think this has gotten better over time as the pandemic has gone on, but certainly initially when lockdowns were in effect, a lot of the regular resources that these families may have had access to previously were not available or were available less frequently, like home visits. And so this is an area that, particularly folks who are seeing kids who know that families are involved with CPS, I really encourage you to kind of pay special attention to this group because we know there may be some increased mental health concerns for these kiddos and possibly increased rates of maltreatment and neglect. Okay, and then another group that's at high risk are LGBTQ plus youth, right? So we know there are existing disparities already before the pandemic in terms of access to care, in terms of mental health outcomes, and then add the pandemic, that makes it much more challenging. We also know that for many of these kiddos, there's a lot of social support that they might be getting in environments outside the home. So, maybe in friend groups, peer groups, or at school, or activities outside of school. And it's possible that now they're in a home where they're feeling rejected and they're not having access to these kind of typical social supports that they would have had before. There's also unique challenges to working with these kiddos remotely because we don't know how private their conversations might be, right? We as therapists can do our best to try to ensure that there's privacy, but we can't kind of guarantee it in the same way that we're able to when we're in the clinic. And so there's definitely a unique challenge there that we need to pay attention to when providing telehealth. Similar thing here. So for kiddos who have autism spectrum disorder or other developmental issues, we know that for these kids, they get a lot of their services at school. And so when school is on lockdown, they might not be getting these essential services that they've been used to getting. We also know that one of the core features of having an autism spectrum disorder is that, there's it's difficult to adjust to these changes in the routine and the environment. And the hardest part is that the environment has been changing back and forth, right? It's not like we're talking about one change that happened in March 2020 and then we just stay there. It's been a lot of back and forth in and out of school. And so these constant changes in the environment and the routine can be really challenging. Kids might also, depending on their developmental level, might not understand why these new rules are in place. Why are things canceled? Why do we have to stay home? Why do we have to wear a mask? And so that definitely presents some additional challenges for these groups. Another group that's at higher risk are youth from racial and ethnic minoritized groups, right? So again, we know there are existing disparities that have been around forever in terms of access to care and outcomes that are only exacerbated by having the pandemic. We also know that there's overrepresentation amongst hospitalized patients and COVID deaths among Black and African American groups and Hispanic and Latinx groups. So not only are there existing disparities, but then you add this overrepresentation in the people who are getting sick from COVID. So naturally, these kiddos are likely to be experiencing more grief and loss, right? Because there's more likely that there are people in their family, even maybe their close family, who have been affected by COVID. And so another group that we want to really pay special attention to when it comes to looking at the impact of mental health, of COVID on mental health. So what can we do about this? Right, I want to spend a little bit more time here because I want to really focus on what are some of the things we can do to mitigate these concerns. The first and I think most important thing that we can do as adults, whatever our relationship is, right, whether we're the parent or the caregiver or the coach or the therapist or the aunt or the uncle, whatever, we're an adult and we are one of these kids, main adults in their life. It's really important for us to acknowledge and validate the fact that this is a pretty bad situation. There's lots of really tough things about it. And it's okay to say that. It's okay to acknowledge that this is really hard. And open those lines of communication, right? Kind of ask kids like, this is how this is hard for me. How is it hard for you? What are some of the things that you miss? What are some of the things that you wish that you could be doing, right? What are some of the ways in which this pandemic has impacted your life? In addition to opening lines of communication about what COVID is, right? And I think depending on the age of the kid, right, we want to use developmentally appropriate language and information. And there's lots of really cool like coloring books and storybooks and things like that online that really kind of use a developmentally appropriate approach to explain what's happening with COVID to kids. And so we want to really communicate openly and we want to start those conversations rather than waiting for kids to kind of come and ask us what's going on. Why do we have to do this? We also want to really focus on what we're doing to stay safe. So especially for kids who are already anxious, the COVID world is really scary, right? We can't go certain places. If we do go certain places, there's all these rules about how close we can stand to people. We have to wear masks, right? It makes it feel like a really scary place. And when we're in that situation, it's, our anxiety is going to skyrocket. And so we really want to highlight for kids what we're doing to stay safe, right? So kind of turning those things on their head and saying, actually, yes, COVID is really scary. That's why we're doing these things to stay safe, right? That's why, we're avoiding going to, the mall, or that's why we're making sure that we wear a mask every time we go outside. That's why we're washing our hands all the time, using hand sanitizer, that type of thing, right? So really kind of highlighting the things that we're doing to stay safe and focusing in on those to help kids remember those things and maybe not think quite as much about the scary elements. Another thing we want to try to do, and I want to emphasize try here because I think it is extremely challenging, right? So I think, again, we want to focus on this as kind of an aspirational goal, something we always want to move toward, but not necessarily something that's going to be reached at a particular point in time. But we know that kids really thrive on structure and routine. We know that it helps them feel safe, helps them feel comfortable. There's a reason that, teachers start out the day by going through the daily schedule during circle time is, kids are kind of used to having that plan and that expectation. And so the more that we can structure the routine, I think the better it is for kids. A couple of ways to do this. Some families I work with are doing things like having maybe like a family meeting in the morning really quickly where they go similar to circle time, where they kind of go through what the day is going to look like. I think this can be especially helpful for kids who are doing e-learning because, going from that environment where you go to math and then to science and then to English and everything's really prescribed to then being in an e-learning environment, which is really variable from school to school in terms of how much structure there is, can be really tough. And so this is where I think parents and caregivers can come in to try to implement a little bit more structure. Even if that means, on Saturday, we start out by having pancakes, and then the next thing we're going to do is play with Legos, right? Just giving them a general sense of what to expect for the day can really reduce some anxiety. Another thing that's important is to continue to implement rules consistently, but with flexibility, right? And again, this is kind of a really delicate balance that we're trying to find here. We want rules to be consistent because it goes back to that really, structure and routine that we know is helpful for kids. If kids one day are able to do kind of whatever, and then the next day there's really strict rules, it's really confusing and they're not quite sure what they're supposed to do. So we don't want to say, just because it's COVID, all the rules go out the window. That said, we also want to understand that things are going to have to be different sometimes, and we're going to have to be flexible, right? It may be that before the pandemic, for example, there was a 30-minute limit on screen time in a particular household. That's probably not going to be able to hold up in post, or I don't want to say post-pandemic because we're still in it, right? But in pandemic times. And so we just want to make sure that we're being really thoughtful about why are the rules in place? Like, what is the spirit of the rule, right? And how can we stick with that, but with some flexibility? For example, there may be limits on types of screen time, right? Maybe if it's screen time where we're FaceTiming with grandparents, that doesn't quite go toward the limit, right? Because we know that the purpose of that is really to increase social support on both ends. But maybe then the screen time could be a limit of 30 minutes of video games, for example, right? So kind of sticking with the rules, but thinking about them and making them a little bit more flexible to fit the reality of what's kind of happening these days. Another thing that's really, really important is self-care. I talk about this with the families I work with really often. And a lot of times I've heard parents kind of put their self-care on the back burner. And they're like, well, it's all about my kid, and I really just want to make sure that I'm doing the best for them. And I usually try to challenge them a little bit and say, I think one of the best things you can do for your kid is to take care of yourself, right? So if folks have been on a plane or seen in the movies where, the mask comes down when the cabin pressure's off, they always tell you, you need to put your own mask on so that you can help other people. If you're passed out because you don't have enough oxygen, then you're not going to be able to help anybody around you, right? So self-care is not selfish. It is important, especially for parents and caregivers, because there are other people who are really relying on that. So finally, we want to watch out for those signs and symptoms that I mentioned before. We want to look for things that are, problems that are recurring, problems that are causing a lot of distress, either for kids or, the people around them, siblings, parents, caregivers, or things that are getting in the way of daily life, right? So we're not able to do things that we want to do because of the, this problem that's been happening recently. So in situations where parents are concerned, parents or caregivers are concerned about these signs and symptoms of mental health issues, there's a few different things. There's not an exhaustive list, but I think it's a starting point. One thing is talk to a primary care provider. right? So lots of times primary care providers have kind of established relationships with mental health providers in the area. So that can be a great place to start to, get some more information or get a referral if the PCP, thinks that that's where kind of we're at in terms of the behavior or emotional concern. Another thing is, right, Indiana did pass this legislation back in July, requiring school districts to have this MOU with community mental health centers or other licensed mental health providers. And so school-based services can be a really good option for kids, especially now that we're, lots of schools are back in the building. The great thing about school-based, lots of great things about school-based services. One of the main ones is the convenience, right? Kids are already there, the therapists are coming to them. Parents aren't having to take time off work, find childcare, drive to the appointment, those types of things. And so the other great thing is that school-based therapists are kind of embedded in that environment. So they're able to get a lot of information about what are some of the things that are happening in that environment for kids. They can talk with the teachers, or they can observe the kid, interact with peers and things like that. So that's another excellent option. Another option is to contact your community mental health center. This is a link to all of the kind of basically find your local community mental health center through DMHA. You can also just Google Indiana, find local community mental health center. And their catchment areas I'll show you in a second. So everywhere in Indiana is covered by at least one CMHC. And also searching for some telehealth options. There's lots of things that are available across the state, and you may not, be close to something, but if they're doing telehealth, it might be something that's now available to you that wasn't available to you before. I have lots of families that I'm seeing that are, maybe 2-3 hours away, but because we are able to do telehealth now, that this is something that's become available. So this is the just map of the community mental health center kind of areas in Indiana. And so just so you can see that there are, all of the different counties are covered. So coming back to, the concern about kids or teens who may be suicidal, I think it's really important to go over the fact that the best thing that we can do is ask. We don't have any evidence to suggest that asking kids if they're suicidal puts thoughts about suicide in their mind. And in fact, what we have learned is that many kids will actually share with us the way that they've been, feeling or the thoughts that they've been having, and then we're able to intervene and provide some support. It's really important that when we ask, we actually use the words, have you been thinking about killing yourself? A lot of times pretty much every time, that's a really hard thing to say, even for a therapist. I can only imagine what it's like to say that to your own child. But it's important to use those words rather than, kind of a euphemism, like, have you been thinking about hurting yourself? Because we really want to be specific about what it is that's going on. And we want to make sure that if the thought is, I have been having thoughts about killing myself, that we are addressing that in the appropriate way. So this here is the Ask Suicide Screening Questions Toolkit. It's a link to that toolkit. It's all free. There's lots of resources. And it's tailored to different settings, inpatient medical settings, outpatient medical settings, and things like that. This is what the actual, one of the screening tools looks like. So what I like about this is that it's all in one place, each specific question that we can ask, and then, below the next steps, right? So what happens if they say yes to 1 through 4? What happens if they say yes through 5? And then also at the bottom, you'll notice there's some resources there. I like to, when I'm working with families, have kids and parents put these phone numbers into their phone so that they're right there ready to go. Nobody's having to Google anything or find anything in the moment. The other thing that I like to remind families is that these lifelines and hotlines are not just for the person who is experiencing suicidal thoughts. They're also to support family members or loved ones of that person through whatever situation is happening. And so sometimes that's something that I've heard from families that they weren't aware of. So I think it's important to mention. So let's talk about some resources that are available. So there's kind of 4 links here. I'm going to go through each of them here in a second, but definitely not exhaustive, right? Lots of different places have come up with lots of resources during this time. And so by no means is this an exhaustive list, and you guys are all going to be getting these links through email tomorrow. But I just want to go through a couple of them, which, to talk about some of the types of things that might be available. Oh, no, it's not letting me go forward. Let me try again. There we go. Okay. So at the Riley website, there's all kinds of different resources for COVID-19 and for caregivers. This one is a really cool video on kind of how to create those family routines that I talked about earlier by one of our Riley School Program teachers, Kristen Weichel, there on the left. So this is, I think, a really helpful video to just kind of get an idea of what are some of the ways that we can get creative about routines during this time. There's also fun articles like how do we beat boredom at home during COVID-19, right? This is one thing that we've had to get super creative about, especially during the winter when there's not a lot of outdoor time possible. I know, I work a lot with kids who have ADHD, and it's been really challenging for them to be sitting in one place all day, especially if they don't have a lot of space to run around. I've had some families that got really creative and did things like making a fort/obstacle course in the living room, right? And just having kids, they have to like jump 3 times on 1 foot or, roll on the floor 2 times, just kind of creative ways to try to get some energy out and, beat that boredom that I think, frankly, all of us are experiencing during this time, but I think is especially salient for kids. Another resource that I really like, and this is actually a new resource that started in 2020. It's an initiative through the Indiana DMHA, and it's called Be Well Indiana. And they have all kinds of resources throughout the lifespan. So this is not just focused on kids. There's lots of videos on different types of topics. There's a helpline that you can click on and call. And I know they have lots of great ways to make this accessible. So for other languages or for folks who are vision impaired, they have different options. And so I think this is an excellent resource that is available that's specific to our state here in Indiana. Another resource that is kind of a classic whenever we're thinking about stress in kids is the National Child Traumatic Stress Network. They have all kinds of information about trauma-informed care, but they've also put out these COVID-19 specific resources. And there's all kinds of information here about how this might affect kids physically, emotionally, how to help families cope, and all, kind of things like that. I often find myself going to this website to find information, kind of specific information to share with families. And so I really encourage you to check this one out. And it's the national, or nctsn.org, so National Child Traumatic Stress Network. And then we have the Child Mind Institute. So this one gets lots of press because they have a really famous, like as you can see, Emma Stone, famous people on their board. And so I think that is great because they have lots of resources, right? And so they have all kinds of different things for parents, for kids, for educators, and they are specific to things from what to do for kids who have ADHD and depression during the pandemic, right? So it really gets narrowed down to specific groups and how the pandemic might be affecting them. And so I really think it's a wonderful resource if you have some time to kind of check it out and go search. They have nice kind of downloadable handouts and things like that. And all of this is evidence-based. And so that's really important to me too, is kind of, this is something I share with families, is like, if you're going to be going online to search for stuff, like, let me give you a couple of starting points, and so that I can be confident that they're getting good information. All right, so these are my references. And again, these are going to be all sent to you, so you can look at them in detail later. So thank you very much. I wanted to make sure we had lots of time for questions. So I'm glad we were able to make that happen. So I know there's probably lots of things that we want to talk about. So I'm going to go ahead and stop sharing so that I can make that a little bit easier. Okay.
Thank you so much. Before we begin with the answers and questions and answers, I neglected to say at the beginning of the lecture, and I apologize, that this lecture this month is being co-sponsored by the IU Health Risk Retention Group. And so that's why Jennifer and Elizabeth are on the call with us. And so we appreciate their support and their collaboration with us, and look forward to how we can be back in person collaborating again next year. So Gabby, thank you so much for the really practical. That was one of the things that when we all got together that first time, we said we wanted something practical. And so you led us through so many practical applications here. We do start having questions coming in, so I'm just going to start reading them to you. So talk about how you're treating this through pharmaceuticals. Does ADHD medication exacerbate the emotions that you mentioned?
Great question. I'm not going to comment on pharmaceuticals because I'm a psychologist and not a physician. And so I think it is a wonderful question. I want to stick with my area. I will say that I always encourage my families, if they're having a concern about how ADHD medication might be affecting emotions, especially nowadays, right, that things have been really different, talk to your prescriber. I know those are things that prescribers want to hear. They want to hear when those concerns are going on so they can address them.
A question about the efficacy of telehealth counseling for kids compared to in-person.
Mm-hmm. Yeah, that's an excellent question. And actually, we have some good evidence that telehealth counseling can be really effective. Even before the pandemic, lots of folks were kind of looking into this area to see if this was one way that we could impact care. So in terms of access, I'll get to efficacy here in a second. In terms of access, it's very clear that it helps improve access, right? It reduces the need for transportation, childcare, leaving school, leaving work, all of those things. There's also good evidence so far in terms of efficacy. There's especially good evidence in terms of behavioral parent training, which is a lot of the therapy that I do, where we work with parents and caregivers to learn effective behavior management strategies. I think partially the reason for that is that we're actually able to see the environment where kids and families are living in, right? So it gives us kind of additional information about that we can use as part of our therapy. But there is also emerging efficacy for things like anxiety and depression. I think it likely is going to be age specific, right? So it's going to be a lot harder to engage a 5 or 6 year old in individual therapy for something like anxiety or depression via telehealth. I think for teens, it's pretty much the way that they're communicating anyway. So it's actually often pretty easy to get some engagement, and especially if therapists get creative. So lots of times I'll have them screen share and show me videos that they like or music that they like, and it can really help us build rapport.
All right, here is one. It looks like a mom is asking, I have a senior whose motivation has plummeted. She's grumbled, ugh, I wish I was dead, which seems more related to depression than actual suicidality. I've asked her more about this, and she clarifies she just feels like schoolwork is useless now. Are there resources to offer hope to older students and young adults other than open communication? Because it doesn't seem to be enough.
Yeah, it's really tough. I'm so glad to hear that you're asking, right? We always want to ask. Many times the answer is no, I'm just XYZ, but asking the question is, I think, good for everybody. I think, like you said, it's not enough. One of the things that I have found helpful for some of the teens I work with is just thinking about the future a little bit, right? And thinking about what are some of the things that you are looking forward to doing when this is over, or when restrictions ease and things like that. And sometimes kind of thinking about those things and looking forward to them can give us a little bit of hope. But I totally hear you. I mean, the open communication is not enough, and this is just a really challenging time. If it's getting to the point where you're feeling like depression is really a main concern, I think, talking to a PCP, talking to a therapist could be a good idea.
Robin, you muted. Sorry, I saw that. Thank you. That's the line of 20 and 21 is you're muted. I sometimes struggle to effectively communicate with patients and families in a convincing way how important it is to engage in the resources that you've mentioned: online communication, counseling, peer support, etc. So what sort of language do you use, and what motivates patients and family? What motivators for patients and families do you find that works?
Yeah, that's a great question. I oftentimes, frankly, kind of do some self-disclosure and share about some of the things that I have found helpful. I'll share. I will be on, this online community to talk about my concerns, and I found it helpful to receive that feedback. I think it's also sometimes helpful to kind of ask families, like, what are some of the things that you feel are missing, and then talk about some of the things that these resources offer, and then see, like, are there any ways in which those are similar, right? Like, are there any ways in which the resources can meet some of the things that you really feel are missing? I think sometimes if we kind of go the extra step to make that connection for them of like, this is exactly how this resource is going to address the thing that you are saying is really hard for you right now, that can help motivate them a little bit more.
I see somebody has potentially raised their hand, and we're not able to unmute. So Eric, if you could just type your question in, we will certainly hopefully get to your question. Someone has wanted to say she's a retired grief therapist, and she wants to make sure that to know about Brooks Place is a wonderful resource for children and adolescents who are grieving. Thank you so much for sharing that. That's a resource I will often share with my families who have experienced a loss recently. Sorry, there are those sirens again. So yes, thank you so much. Brooks Place is a wonderful resource, and they have a really easy online intake form. I have even filled it out with families like during session together. So it's a really great kind of easy way to access that service. All right, so someone is asking, you highlighted how parent mental health can impact child mental health. As someone who works in a pediatric clinic, do you have any recommendations for discussing this with parents and how to address concerns that they might have? Yeah, absolutely. I think it's really important that we talk about the relationship between parent mental health and child mental health without talking about it like it's the cause, right? We know it influences things and it impacts things, but sometimes if we talk about it like it's the cause of child mental health problems, parents can feel, frankly, just really bad, right? Like they feel sad, they feel guilty, lots of different things. And so I think talking about parent mental health as one factor amongst many different factors, like just stress in the family, COVID, school, right? All of these different things all affect child mental health. Parent mental health is just one that we have a little bit more control over than, say, COVID-19, right? And so that's part of the reason that we want to focus in on it, is because there's actually a little bit that we can do about it relative to some of the other factors. I really like the airplane analogy. I think lots of families that kind of makes sense to them, the putting your mask on to yourself before you put it on kids. I think that analogy is useful. So yeah, I think that's a couple of things, kind of making it, really focusing in on how it's one out of many factors, and it's one that we have a little bit more influence over. We have another parent who's just saying that, yes, their high achieving senior has experienced similar challenges with motivation. I have a child who's a junior, and he's having challenges with motivation. So I think it's so hard right now. And I'm an adult and I'm done with school, and I'm experiencing lots of challenges with motivation, right? So I think it's, and I say that, right, because I think it's important for us to be really transparent with kids and teens about the way that we're also experiencing these challenges, right? It's not them, it's just we're in a situation that's the impact of it, right? It does lower all of our motivation, and that's okay that that's what's happening. We can be creative about how to address it, but it's not wrong. I think that's the challenge too, is how to address it. So here's a question about, what are your thoughts about using the Columbia assessment versus ASQ? Yeah, great question. They're both evidence-based, both excellent ways to assess for suicide risk. I would say the ASQ is a little bit quicker. And so it lends itself better to environments where you have to make more of a fast assessment about what to do next. So for example, if you're in a kind of primary care visit, you don't have a ton of time, you can use ASQ, I think, more readily than something like the Columbia. But I think both are great options, and they both have a lot of science to support them. So here's a question that I have. You talked about more telehealth, but also like going outside the box and looking at other resources. When I listen to my podcast, I have been hearing a lot of advertisements lately for, therapy that you can do. And how do you vet those? How do you know that they're reliable? And obviously, if you go to someplace like IU Health, you know that IU Health has vetted the therapist and that they're a good resource. But these are places that are advertising on podcasts. How can you evaluate them?
Yeah, I think that's a really good question. I think it's going to be a thing we continue to have to think about as we move forward, because there are so many like digital, like Talkspace and all different types of therapy options. I think the number one thing is you want to make sure you're working with a licensed provider, right? So you want to look up in the licensing board, you can put people's names in and you can see whether they're licensed, whether there's any kind of disciplinary action or anything that has been done against them. The other thing is, if you've checked it out and it's a licensed provider and it kind of meets the needs that you have in terms of convenience or cost or whatever else, I think one thing that I really encourage families to do when they're looking for a therapist at the very first session is ask, like, what is the therapy that you're planning to do? How is it? How did you make that decision? What evidence is there to support that this is, going to be an effective treatment? Are we going to set goals, right? What are those goals going to look like? We know that goal setting and having a treatment plan and a reasoning, right, like a good clinical conceptualization behind why we're choosing that treatment plan for the concerns that we came up with are all hallmarks of effective treatments across the board. And so I think those are all things to be looking for to figure out whether somebody's going to be, kind of effective for what you need.
Another question from the board. Do you have any thoughts, or what are your thoughts about the detriments to closing schools versus keeping them open at this point on the mental health of children? I know that's a really hot topic.
Yeah. So honestly, I would say that's one where very often I'm glad I'm not the governor or the mayor or somebody having to make those decisions, because there's so many pros and cons. It's so hard to weigh. I think from the mental health standpoint, it's clear that being in school has lots of great effects for kids, right? They're able to access therapy that way. It's a structured environment. They can see their peers. For kids who have additional needs, they get lots of extra supports, right? So there's lots of wonderful mental health reasons for kids to be in school. I think the public health aspect is where, I don't have enough experience, frankly, to weigh, the kind of costs in terms of, the impact on public health of keeping schools open. So I think it's just a really, really hard question. And it also, for teachers, right? Like teachers are in schools and they're at risk. And so I think that's important to take into account, what that looks like for them if they're not having the option to work from home like many of us are doing. So it's just really a tough question that I wish I had an answer to, but frankly, it's tough.
Indeed, school boards right now, they're facing tough decisions.
Mm-hmm.
So can you talk a little bit about older adolescents and therapy and their need for privacy, and potentially mom and dad are not involved in therapy and don't know what's happening? Can you speak a little bit about that emerging autonomy?
Yeah, I think, it's really important that anybody that's under 18, the parent does technically have consent, right? So the parent needs to be involved in terms of providing that consent to treat for the minor. But I think there are, important conversations that can be had at the start of treatment about what that's going to look like. What I often do, when I'm working with teenagers is I have a conversation right in the beginning with the teens and the parents about what are the things that are going to stay private between the teen and myself, and what are the things that I have to share so that everybody's on the same page, right? If anybody's hurting my patient, if the patient is thinking of hurting themselves, thinking of hurting somebody else, those are exceptions, right? That's not a time where I can keep privacy for the teen. But I often talk with parents about how, if other than those exceptions, they kind of allow for us to have privacy and confidentiality, that's what we really need to have effective therapy, right? If a patient's not being honest with me because they're afraid I'm going to share information with their family, then I'm not going to be able to really address what's actually happening. And most of the time, parents, once we kind of talk about that and I clarify those exceptions of like, if there's a safety concern, I will be sharing that with you. Most of the time, parents are okay with kind of stepping back and allowing for that confidentiality.
All right, we are at noon. And so thank you. Thank you so much for, and as Ann Hannon says, for curating all the information in an easy to use format. like I said, you all will be receiving that email tomorrow with those links. Her slides are available. I think Annie has said that if you want to receive the slides, that will be a request in the evaluation. Sometime next week, give us a little bit of time, but this talk will be up on our FCME website. But Dr. Rodriguez, thank you so much for sharing with us and for really just helping to give us some really practical tools that as parents and as aunts and uncles and any way that we contact children that you have helped us today. So thank you.
Thank you. I was happy to be here. Have a good day.
Bye-bye.
Bye.